Dear colleagues, welcome to the OncoAlert eCancer Weekly Round Up, starting off with an amazing paper just out of New England, which marks a historic moment. We don't use the word practice changing often, but Keynote 522 finds that in patients with early triple-negative breast cancer, neoadjuvant pembrolizumab plus chemo, including carboplatin followed by an adjuvant pembrolizumab after surgery, resulted in significantly longer event-free survival than neoadjuvant chemotherapy alone. EFS was 84.5% in pembro chemo arm versus 76.8%. Out on JCO, great news for lymphedema. Prophylactic wearing of compression sleeves recedes arm swelling and delays its recurrence in women who have undergone accelerated lymph node dissection for breast cancer. Out on Cancer, new paper presents implementation of large-scale breast cancer early detection program in resource-constrained settings, real-world experiences from 2 large states in India. Out in Lung Cancer Journal, post-hoc analysis of immune-mediated adverse events of durvalumab from the Pacific trial sees that it usually occurs in the first 3 months. The most common were pneumonitis and thyroid dysfunction. Out on JCO Precision Oncology, first analysis and efficacy of safety of larotrectinib on NTRK fusion lung cancer sees larotrectinib is highly active with rapid and durable responses, extended survival benefit, and a favorable long-term safety profile, including those with CNS metastasis. Galahad, just out in the Lancet Oncology, showing efficacy in niraparib for patients with metastatic castration-resistant prostate cancer and BRCA alterations and prior treatment when NHTs and taxanes. Out on Journal for Immunotherapy of Cancer-Soluble PD-L1 as a potential early marker for progressive disease on nivolumab. Out on ESMO Open, a real-world circulating tumor DNA analysis depicts resistance mechanisms and clonal evolution in ALK inhibitor-treated lung cancer. OncoAlliance, out from the American Cancer Society 2022 Cancer Facts and Figures, highlighting alarming disparities. Risk of cancer death for Black people, 19% higher for men and 12% higher for women, with systemic racism driving disparity. Out in JAMA, study sees that removing fallopian tubes during hysterectomy or instead of tubal ligation appears associated with a reduced ovarian cancer risk. Huge congratulations to our OncoAlert colleague Andrea Bolo and Tony Schwery on being selected the American Society for Clinical Investigators. ASCO GU coming up this week, and we will be there reporting live in real time with our amazing GU faculty. Ending this podcast, reminding you to tune in to this month's ASCO Plenary this coming Tuesday, February 15, 3 p.m. Eastern Standard Time. That's it, folks, your weekly roundup. We'll see you next week.